Good afternoon, everyone. Welcome to our Tuesday at 2 press conference, the one we said we weren't going to hold unless we had some major developments. And, well, we had a lot of major developments in the last few days. So we wanted to bring you up to date on COVID-19 in our community and, of course, the major developments associated with mask wearing because there's a lot of confusion out in the general public and the business community as to what the rules are. We want people to understand that. So we welcome back, of course, Kendra Schmidt from Deaf Access Services to provide us the American Sign Language, and you'll hear very shortly from Dr. Gail Burstein. First, we'll give you an update on where we are with COVID. Certainly doing much better in the last couple of weeks than we were about a month ago. In total, since the beginning of the pandemic, 88,028 unique COVID-19 cases have been confirmed. These are not duplicates, so these are 88,028 residents in Erie County. Of confirmed cases, that number probably is higher of all cases, but these are what we know confirmed. In the last 7 days, we had 749 total new cases, 82 total new cases per 100,000 residents over the last 7 days. So we've seen a big drop in that number, and we'll talk more about that and why it's good. Hospitalizations on May 16th, there were 169 COVID-19 patients in Western New York hospitals, 52 of those in the ICU. And of those 169 patients, 138 patients were in Erie County hospitals, 36 in the ICU, 28 on an airway assist, 2 died. So the people who are in the ICU, the vast majority of them are very sick because the percentage is approximately, was that 80% or so of the individuals in the ICU are on an airway assist, and that's not good. So we certainly offer our condolences to those who've died, their families, and we unfortunately are averaging about 2 deaths a day in the last week to 10 days, which is down from where it was, but still, we're still seeing too many deaths of Erie County residents. Our hospitalization data on the 2-week chart, May 3rd to May 16th, 68% of Erie County's hospital beds are occupied. COVID-19 hospitalizations have decreased 35% in 3 weeks. I'm very happy about that. And 26% of the COVID-19 patients are in the ICU. Roughly a little less than 2/3 of all COVID-19 hospitalizations are under the age or 64 and under. And we need to remember that we've done a very good job of vaccinating our 65 and older population. And as a result, the age of individuals who are hospitalized has gone down. I can't imagine what it would have been like over the last 2 months if we had not had vaccinated the large proportion of our older population as we did. Because if we're seeing this many people in the hospital that are 64 and younger, you can only imagine what it would have been if we had not vaccinated as many people 65 and older as we have. You will note in the 2-week period, you see that the deaths there were a couple days without deaths and then some with 3 deaths. So it's very discouraging to continuing to see deaths. I want to see zeros on that bottom line all the time. We're just not there yet. And considering the number of people in the ICU that are on an airway assist, I'm very concerned we're going to continue to see deaths for a couple more weeks. Confirmed cases over the past 6 weeks, this is the huge drop. It's noticeable dating back to April 10th, the week ending April 10th versus the week ending May 15th. We had roughly 3,400 new cases the week ending April 10th, and we had 738 for the week ending May 15th. You see the tremendous drop in total new cases in the past 7 days per 100,000 persons. This is significant. We dropped under 100 for the first time in months, and that's important because once you go below 100, the region's considered a substantial risk of COVID-19 transmission as compared to a high risk of COVID-19 transmission, and that matters, especially for schools with regards to the standards that schools can be at. Weekly cases dropped 32% last week from the previous week, and they're down 68% from the week of April 24th. That's a great sign. There are still new cases every day. Every day our Department of Health gets information indicating that more people are testing positive for COVID-19. It's just not at the same amount it was before. So just remember that COVID-19 is still out there. If you are unvaccinated or partially vaccinated, you should be taking precautions, as we'll talk about, including continuing to wear masks. Now, COVID cases by zip code for the week ending May 15th. We're still seeing some of our largest numbers of new cases in the city of Buffalo. If you look at the city of Buffalo zip codes, they are either just below or above or substantially above the 100 new cases out of a 7-day average for 100,000 population. We've seen a big drop in the suburbs, including some of the suburbs that were big problems for a while there. We do have some areas of concern that we are very much worried about, including Buffalo-based zip codes, 14204, 212, 215, 206, 211, 208. And it's not surprising to see a correlation between the newer cases coming from these zip codes and also seeing lower vaccination rates in those zip codes. Best way to protect yourself from catching COVID-19 is to get vaccinated. Age group, total new confirmed cases per 100,000 persons. We're still the highest amount in the only two age groups now that are over the 100 mark. 100 new cases every 7 days in 100,000 population are the 20 to 29 and 30 to 39 age category, individuals that are in their prime working years. So we've seen tremendous drops in student age population. We've seen huge drops recently in the older age population. We're still seeing what we'd consider high rates of transmission in the age groups of 20 to 29, 30 to 39. So if you're in those age groups, the best way to protect yourself is to get vaccinated. You can still catch COVID-19. You can still get sick from it. And as you'll see, we have had individuals under the age of 40 die in the month of April, just like in the month of May, just like we had in the month of April from COVID-19. So just because you're younger doesn't mean you can't get sick, very sick, or even sadly die. Schools, we've had a big drop in cases associated with individuals who are in a school setting. It's dropped tremendously, basically almost by more than 4 times what it was approximately a month ago, to from over 640 cases to 140 now. This is all cases, new cases associated with individuals who go to a school, students, staff, administrators, you name it. Doesn't mean that the transmission was in school, but it does mean that these are individuals in a school setting. We have seen a tremendous drop. We're very happy about that. Not surprisingly, the biggest number we had was right around the Easter break, spring break, and it just tells us exactly what we were worried about. People who traveled out of the area, they went to areas that they thought were, hey, they're open, everything's great, Florida, Texas, Arizona, and there's still COVID in those communities, and they brought it back. But thankfully, we've seen a nice drop, and that's a good thing overall, especially as it pertains to the school settings. Mortality data. Unfortunately, we have to announce 13 more deaths associated with COVID-19 from May 7th through May 13th. We're averaging 2 deaths a day in May. There's 26 people who had died through the 13th of May. Of the 125 reported deaths from April and May of 2021, only 3 people were fully vaccinated prior to infection. And of those 3 people, is my understanding, they had significant immunocompromised issues. So you could be, if you have immunocompromised issues to begin with and you're vaccinated, you should still wear a mask, as we'll talk about. You can get sick, and as unfortunately we've seen, you could die. And the other thing that we've noticed from the April and May deaths, 43% of persons resided in a Buffalo City zip code. That is up tremendously from what we saw through the vast majority of the pandemic. It started very high. We dropped it down to what really is more the city of Buffalo percentage of the entire population. It's in the mid-20s, and it's really jumped up where 43% of those who died in April and May resided in a city of Buffalo zip code. And as we've talked about recently, unfortunately, the city of Buffalo zip codes have some of the lowest vaccination rates. So if you live in the city of Buffalo, get vaccinated if you have not been vaccinated. There is COVID-19. The newest cases, we're seeing a preponderance of the newest cases coming from the city of Buffalo, so it's still out there. It may be better, but you can still get sick. And unfortunately, as we've seen, you can still die. In the month of May alone, 2 people under the age of 40 have died from COVID-19. 2 have died in the age group of 40 to 49. We've had 26 deaths in total in the month of May after 99 in the month of April, with April having been the highest month ever since the beginning of the pandemic of deaths under the age of 50. So please be careful out there. Get vaccinated. Okay, now we're going to talk about what the CDC recommended and the state has moved forward and what Erie County is doing as it pertains to our buildings and our staff. The CDC issued its report, which New York State adopted, with regards to vaccinated individuals, saying vaccinated individuals no longer need to wear masks, except in certain settings. Effective tomorrow in New York State, immunocompromised and unvaccinated individuals should continue wearing masks and socially distance. Vaccinated individuals seem to be protected, but unvaccinated individuals we know are not. And if you're immunocompromised, even if you've been vaccinated, you should still wear a mask. If you're unvaccinated, you should still wear a mask. And when we're talking about unvaccinated, we're talking about those who have gone through the full vaccination process. So 2 weeks after your second dose for the Pfizer and Moderna, same thing Johnson & Johnson, if it's a one shot. If you've gotten one dose of Pfizer and you're still waiting for your second dose, you should still be wearing a mask. You are still at risk. Masks are still required for all persons, regardless of whether they're vaccinated or unvaccinated, on public transportation. So if you're on the Metro bus, you're on the Metro rail, even if you're vaccinated, you have to wear a mask. If you're unvaccinated, you have to wear a mask. Same goes for airports. Nursing homes, homeless shelters, correctional facilities. Erie County has 2 correctional facilities, our jail and our jail out in Alden and our holding center downtown. Of course, there's the Wendy Correctional Facility. There's other correctional facilities in Erie County. You have to wear a mask there. Schools, everyone in schools still has to wear a mask, regardless of whether they're vaccinated. And healthcare facilities and healthcare settings. And Erie County, of course, has clinics and healthcare settings, so anybody coming into there has to wear a mask. Private venues may establish higher regimens, higher standard of care, so to speak. So they can require everyone, regardless of whether or not they have been vaccinated, to wear a mask. So shopping centers, movie theaters, bars, restaurants can follow the same standard as before and say, okay, you can take your mask off when you get to the table, but if you're walking around the establishment, you're required to wear a mask. And I know, as published reports have noted, and what I've heard from locations themselves, many organizations are still going to continue mask wearing in their facilities for their staff as well as for their guests and invitees. That's to protect individuals. Now, as it pertains to Erie County, we are updating our mask and social distancing policies for county employees and county work sites effective tomorrow. Fully vaccinated employees, masks are required in public areas or when they are interacting with the public. So if you're a fully vaccinated individual and you're at your desk, you don't need to wear your mask. If you're in a meeting with 2 other individuals and none of them, and they're all vaccinated, you don't need to wear your mask. But if you're walking in the hallways, if you're using the elevators, if you are in a situation where you're dealing with the public, and of course, Erie County government has a lot of direct-facing positions that deal with the public, you are required to wear a mask. Partially vaccinated or unvaccinated employees, masks are required everywhere unless you are in a private office or you are more than 6 feet from people. So if you are partially vaccinated, you got 1 dose, or you've got 2 doses, but you're waiting for your full antibodies to kick in after the 2 weeks, you are still required to wear a mask everywhere, except if you are in a private office or more than 6 feet away from other people. So if one individual is vaccinated, another one is unvaccinated, the unvaccinated person is still going to have to wear a mask, even if they're partially vaccinated. To protect our clients, our vendors, our employees, and we do have some employees that are immunocompromised, for the time being, regardless of vaccination status, we are requiring all visitors, clients, and vendors entering Erie County property, whether it's the Rath Building, one of our clinics, the Erie County Training Facility, you name it, you are required to wear a mask at all times. Now, we are going to evaluate these policies on a monthly basis based on employee vaccination rates and community vaccination rates. As Dr. Burstein will talk about, our community vaccination rates are getting better, but we are basically 50% of all population in Erie County has not been fully vaccinated. And that means that out of everyone you see, including children, 1 out of 2 individuals has been fully vaccinated, the other ones haven't. So we do know that there are still new cases in our community. We know that there are new deaths in our community. We've had 3 deaths of employees in Erie County government. And I don't ever want to have to deal with another death of an employee in any situation, nevertheless from COVID-19 when they could have been protected. This will surprise a lot of folks, but as of through May 10th, I am aware of 530 Erie County employees had tested positive since the beginning of the pandemic for COVID-19. And we still have had some employees test positive in the last couple of weeks. So to best protect individuals, including everyone who comes in our doorways, we're setting a standard which will be reviewed on a monthly basis. But for now, all visitors, clients, and vendors are required to wear masks regardless of vaccination status. We do not want our security guards, we do not want other individuals to have to confirm whether someone at that location has been vaccinated. We do not want to get into fights with individuals to say, where's your card? Let's see your Excelsior pass. We want to be able to ensure that we have an open environment, but one that protects everybody who walks in the doors, the unvaccinated, the immunocompromised, or others that may be at risk. So we will reevaluate these policies on a monthly basis based on our county vaccination rates for our employees as well as our community vaccination rates. And finally, before I turn it over to Dr. Burstein, businesses and organizations. They can set policies for masks and social distancing for fully vaccinated people. So grocery stores, as I said, movie theaters, restaurants and bars, they can say, we want you to wear a mask. That's legal. You do not have a right to walk into an establishment that is a private entity and say, I have a right to walk in here without a mask if they require a mask. You do not have a right to do that. They can set a higher, stricter standard for entry into these facilities than what maybe is the government says is correct. So if you go to a store, and I'm not going to give a name because I don't want to name an organization, but if you went to a grocery store and the grocery store says, we are still requiring masks of everyone who enters, please do not walk into that store without a mask and start fighting saying you have the right to go without a mask. That's not true. They can set a higher standard. And when it comes to issues associated with capacity requirements have been eliminated in New York State effective tomorrow. However, for bars and restaurants, they still have to have a 6-foot separation. If they want to go to 100% without the 6-foot separation, they can. But they have to require proof of every person who comes in to be vaccinated. Most bars and restaurants don't want to do that, so I would expect that most bars and restaurants will still have the 6-foot separation to ensure that there is safety between vaccinated and unvaccinated individuals. And if you have questions as a business owner, you should check and confirm the New York State guidance on the New York Forward webpage. It was just updated by New York State yesterday. It is very comprehensive, and I would suggest that you go to the New York State Forward website and look up what it is as it pertains to your business. Some businesses are going to require their employees to still wear masks. They're going to require people to come in and wear masks. That's okay. That's good. That means we're protecting individuals. Please don't mock individuals who are wearing masks. You don't know why they're wearing a mask. Maybe they're unvaccinated. Maybe they can't get vaccinated because of an issue they have with regards to their health. We know children. We can do 12 to 17-year-olds, but we can't do younger than that. We know that there are immunocompromised children in our community. If you see a child wearing a mask, please don't criticize them. That mask may be saving their life. So what we want is everyone to understand that working together, we've done a great job in reducing new cases of COVID-19 in our community. We want that to continue. We've put the policies in place as it pertains to Erie County government. That'll be effective tomorrow, and we will be revisiting those on a monthly basis. And the best way that we can eliminate the masks for even the vaccinated and all these different kinds of settings is to just get everyone vaccinated. Simple as that. So with that, I'll turn it over to Dr. Burstein to talk about some of the testing and vaccination issues. Get your little...
Thanks. Good afternoon. So I think a really important part of our COVID-19 control is for people knowing their status, especially people who are not fully vaccinated, who are close contacts. We're seeing a lot of outbreaks in businesses, what I'm going to talk about in a minute, where people continue to come into work because they feel they're essential employees, even though they've been exposed by somebody else at work, and they're infected, they don't know their status, they're not getting tested, and place lights up like wildfire with with COVID-19. So it's really important, especially if you're not fully vaccinated and you have been in close contact to COVID-19, to know your status. It'll help you take care of yourself. It'll make sure your family and your coworkers are protected. All you need to do to get a test by the Erie County Health Department is an appointment. Just call one number, 858-2929, to schedule an appointment. We have the PCR molecular diagnostic test. The turnaround time is between 1 and 3 business days. We're getting a turnaround time in 1 day right now. And then our point of care, our rapid test, you get your results before you drive away. So this is a great idea to know your status. And we've had a drop in about 15,000 tests over the past month. So not as many people are getting tested. It's still an important part of getting us out of this pandemic. I just want to talk about some trends that we're hearing from our contact tracers. So as I mentioned earlier, some businesses are still not being forthcoming of disclosing all the close contacts in their business. I mean, specifically over the past week, we've had problems with daycare centers, not disclosing all the kids in the classroom where there was a case. And we always find out about it. Recently, parents have been calling us, said, hey, I know that there was a case of COVID-19 in my child's class. Nobody's called me. Why not? Well, we didn't have their name as a close contact. So please, it just works so much easier if businesses and everybody can fully disclose who close contacts are. We can get everybody in quarantine and stop the spread, and businesses can reopen fully. Also, we have, as I mentioned earlier, small businesses are bringing their workers back because they're claiming that they're all essential, and when they have a case, if one of their employees or somebody in the institution has COVID-19, everybody comes back to work. Nobody's getting tested. There's somebody in the group that has COVID-19. They're all working in a small space. It just, the COVID-19 spreads, and sometimes businesses have to close because then they don't have enough staff left that can work it. So it's, really important to do the right thing, make sure at least people get tested. And then, in that instance, if they're fully vaccinated, they don't have to worry about it, and because they're much less likely to get infected, and they don't have to worry about transmission. And also, we're finding that people who are close contacts, if they are getting a test, many times they're test shopping. So somebody's a close contact, they do their due diligence, they go and get a rapid test, it's positive, they're like, I feel fine, I don't believe that result, I don't like that number, and so they go somewhere else and try to get another test. However, we get the results of every single test. So if we find that you're a close contact and you have one positive test, that is one positive test, and that's all it needs, all it takes for us to issue an isolation order and make sure that you stay away from everybody else, because if you're high risk as a close contact, you have a positive test, you definitely have an infection. So it's really important to stay in isolation and make sure that nobody else around you is infected. And some good news, talking about our vaccination rates. So we are making some slow progress, although it is progress in Erie County, getting all our residents vaccinated. So as of May 17th, 52% of all Erie County residents have had their first dose of COVID-19 vaccine. That's 476,637, and that's 63% of all eligible residents. And then 44% of Erie County residents have completed their vaccine series, and they're fully vaccinated. That's 405,136 Erie County residents, which is 54% of all eligible residents. So we got to get that number up. We have to make it to at least 70% so we can all feel comfortable, we can all feel safe, we can all get the businesses open all the time, schools are open, and kids are in sports. We got to get up there. And so this is a chart that we show every week, looking at the distribution of vaccine uptake by zip code. So the yellow are rural areas, green are suburban areas, and blue correspond to urban areas. So you can see that many of our urban areas in the city of Buffalo have the lowest vaccination rates. As the county executive noted, that those are the areas with the highest number of cases of COVID-19, and those are also the areas where we're seeing the most deaths in Erie County. As the county executive mentioned, 43% of our COVID-19 related deaths in April and May were from in the city of Buffalo, whereas only 28% of Erie County residents live in the city of Buffalo. There's a disparity there, and we can fix that disparity by getting more people vaccinated. So we're trying hard. We know this is a new vaccine. We know people have questions, and that's okay. Ask your healthcare provider those questions. You can call our hotline at 858-2929. We have educated people that are informed and can answer all your questions. So help us get you vaccinated. Some other great statistics around COVID-19 vaccination. So it's only been about a week since the FDA authorized COVID-19 vaccine for kids between the ages of 12 and 15 years. And so far, 5% of all our 12 to 15-year-olds have received their first dose of COVID-19 vaccine. So that's a little over 2,000 12 to 15-year-olds. And about a third, 34% of 16 to 17-year-olds have had their first dose of COVID-19 vaccine. So that's about 7,500 16 to 17-year-olds. So we have to keep forging ahead and getting more kids vaccinated. I know our pediatricians are helping us, our schools are helping us, and we are going to move on and get more kids vaccinated. And then the good news is that something we should be so proud of in Erie County is that 83% of Erie County residents who are 65 years and older have had at least one dose of COVID-19 vaccine. So the good news is that's a very high percentage. The bad news is it's only just a little bit more than last week. So we want to get that number up. This is such a vulnerable population and such a precious population. So we have to make sure we get them protected. So we're trying to make it easy for everybody to get vaccinated. We still have our large vaccine sites at ECC South, ECC North, and Keyback Center. We're also doing pop-up clinics throughout Erie County. You can go to our Erie County vaccine website and look to see what is closest to you and most convenient. We ask you to make an appointment. However, if that doesn't work for you, just walk in. We will not turn away anybody who is eligible. And then if it's maybe a little bit too much of a hassle, you have a lot going on, it's hard for you to get a vaccine clinic, just give us a call at 858-2929 and we will deliver a vaccine directly to your house with our Vax Visit. So you don't have to go anywhere, just give us a call at 858-2929. We work with Buffalo Home Care right now. They're a home health nurse agency. They will contact you and schedule a time for you that is convenient for you to get vaccinated. So please help us make you healthy, help us make you safe from COVID-19, and help us get you vaccinated. We have a lot of great vaccine clinics that we are really targeting kids that are 12 and up to get vaccinated. We have vaccine clinics happening this week in Springville High School and also at Grand Island High School. We're going to have an ECC North clinic on the 19th. Where we're going to open that up for kids in many of the high schools in the northern suburbs. We're going to have pre-prom part 2, the vaccine number 2s at ECC North, South, and McKinley High School. At MST Prep. And so all those kids that are coming in for their second dose, bring your younger siblings, bring your parents. They can get their first doses there. So we want to vaccinate everybody in the family. Also, we're going to be having a vaccine clinic at our Jesse Nath Health Center, so you can learn more about our health center and get a vaccine to boot. And so we are continuing scheduling up new clinics, so please look on our website and see what works for you. We're also going to have other pop-up clinics for adults in the community. We're going to be offering the J&J vaccine, Johnson & Johnson, so it'll be a one and done. Just need one dose, and 2 weeks later you will be fully vaccinated. This week we're going to be at the Martha Mitchell Community Center, the LBJ Apartments. On Saturday we're going to be in the parking lot of Kleinhans Music Hall. And then next week we're going to be at the Marine Drive Apartments, and again it's the Jesse Nass Center in the beginning of June. So again, there must be a place that is close and convenient to you. Many of these places have some great giveaways, including PPE, personal protective equipment, masks, hand sanitizer, wipes, some other cool giveaways. So please come to one of our clinics and help us make you healthy and safe from COVID-19. Also, the shot and the chaser legend continues with our county executive's brilliant idea. And I can tell you that like a little bit of beer soothes the pain of a vaccination. So highly recommended, as the doctor says. So on May 20th, we're going to be at 12 Gates Brewing Company. On Friday, on the 21st, we're going to be at Soho in Buffalo. So if you like to hang out on Chippewa on Friday afternoons or Friday evenings, that's the place to go to get a shot for a shot. And then on May 25th, we'll be at the Big Ditch Brewing. You know, again, a nice smooth pint is a good way to soothe the pain of a little injection. So go to our Erie County vaccine site to check out what is convenient for you. You can schedule an appointment or just walk in. We are happy to vaccinate you. So I'm going to turn it over to the county executive to entertain some questions, and thank you.
Thank you, Dr. B. I would note when somebody asked me recently why the 65 plus, which is really good at 83%, is 83%, not 100%. And there are a certain group of individuals, especially among the older population of Erie County, who cannot get vaccinated because of health issues that they have. And that's a serious concern because we do know that those people are very high at risk if they catch COVID-19. So we've done better than the state and national averages with regards to overall vaccination, especially in the 65 plus. But if you have a senior in your family who hasn't been vaccinated, it's maybe because they can't for health reasons, and so you have to be very careful around them. Even you should wear a mask around those because they're very much at risk for COVID-19, and we still have seen deaths of people 65 plus in this region. And as we noted, only 3 of the deaths in April and May were individuals who were fully vaccinated. The most had not been fully vaccinated or even received the first shot. So please be careful, especially among the senior population if they haven't been vaccinated. We will go to questions, and we'll start out with Buffalo News, Sandra Tan.
Hi, thanks, Mark. You had said that the health department would be reevaluating its rules for schools and school sports like wrestling in light of the newer, lower confirmed cases. Just wondering if there's any news to report on that yet, and if not, when will any information be coming out about that?
It was reevaluated last week as it pertains to wrestling. We removed the not recommended, and it's my understanding that Section 6 sports in the ECIC, as it used to be called, our teams that have wrestling are preparing to do some meets until the end of the school year. So that was removed, and it was done last week, I believe. Yes, Dr. Burstein saying yes. So that is done, and as we said we would reevaluate it once we hit the 100 threshold, and we did. And we removed the not recommended for wrestling, which means I think every sport that could be played is now has the availability and eligibility to be played in Erie County. WBEN, Brendan Keeney.
Hi, Mark. As we're seeing sporting events around the country open back up, some even to full capacity, are you looking to these events as case studies for what could be done at Highmark and Key Bank come the fall?
Well, we look at all the evidence that's provided to us. I will note, as you may have heard yesterday, the ownership of the Knicks said they're going to primarily have all vaccinated sections, requiring people to have proof of vaccination, and just very small unvaccinated sections, while Radio City Music Hall, so they're going to go to 100% vaccinated. We will keep an eye and watch everything. We'll see what happens with regards to the Blue Jays games that are held in Buffalo. Our intention is to still move ahead, to have 100% occupancy in the fall. And right now, the only way you could have that, if they were to hold a Bills game, let's say next month, the only way you could have 100% occupancy is to vaccinate all. The governor said it yesterday. Sports teams want to have 100%, they can, but then they have to require vaccination of everyone. So it looks like the governor's finally come around to what I announced in April. But we'll keep track of what happens elsewhere, especially during the year, to see if there are any issues. And if we have to have an opportunity to revisit, we would. We always revisit it when it's appropriate. But for now, we're still going ahead with the plan as it was. WBFO, anybody on from WBFO?
Yes, Mark, Mike Desmond. Let me posit a situation that you're familiar with. It's a nice Saturday afternoon. A couple of friends call each other and they're going to play golf. Okay. Do they have to wear a mask on the course? If they decide to stop at the 19th hole, is it masked? And if they decide to drive somewhere for the 19th hole, and they're not quite sure about their friends. Are they masking or not masking? And I would think there are a lot of questions like this out there.
Well, as it pertains to especially outdoor, like golf outside, if a person's vaccinated, then they should not have to wear a mask while golfing at all. And in general, as long as they were able to keep a 6-foot separation between the individuals, social distancing, you wouldn't have even needed to wear a mask previously. That was the standard that was held on golf courses. Indoors is totally different, of course. It's up to the establishment that has the 19th hole as to whether or not they want to require individuals to walk in with masks or not if they're vaccinated. So it is in that situation. If somebody's in a vehicle and they're fully vaccinated, it's arguable that they could go without a mask based on the CDC guidance, but if they don't know the status of their friend, then maybe they'd want to wear a mask while in the vehicle. If they know their friend is completely vaccinated, then of course neither of them would need to wear a mask at all. Andy Young, Spectrum News.
Hi, this question is for Dr. Burstein. The situation with masks and unvaccinated versus vaccinated kind of raises a conflict in families at times with kids who can't be vaccinated because of their age. What sort of advice do you have for parents, that sort of thing, guidance in dealing with that conflict where maybe the parents don't have to wear a mask when they go out to a store, but the kids still would?
I remove my mask. It's there are a couple different issues. I mean, first of all, the parents may choose to set a good example for their kids and wear a mask in public just to show them that this is good preventive behavior, and they're masking just like their kids have to mask, so they can set an example. Also there's nothing wrong with wearing a mask, and again, we have to adhere to what each institution or business's policies are. We're hoping that this is just short term. We're hoping that by the end of the year, maybe even in the fall, the data will be out for either Moderna or Pfizer's trials for kids that are between the ages of 5 and 11, and we'll be able to get even more kids vaccinated. So hopefully this is a temporary situation, but again, mask is protective, and if the kids have to mask, as a parent, as a pediatrician, I encourage parents to mask as being good role models for their kids when they're out in public.
Thank you. Kelly Dudzik, Channel 2.
Thank you. What advice do you have for business owners and restaurant owners now that they're in a position of coming up with their own mask policy? And what kind of resources are there out there for them to come up with those policies and then actually implement them when they're dealing with customers?
Well, they can always talk to our Department of Health. Many restaurateurs are used to dealing with the Department of Health because we're the ones that have to give them health permits for food. So if they have questions, they can always call our Department of Health. We certainly, and I've had a conversation with a couple of restaurateurs in the last 48 hours who were really uncertain as to what they wanted to do because they've had issues where people have walked in saying we don't need to wear masks anymore, and restaurateurs are like, well, no, we do. And oh, by the way, we vaccinate, and they're like, I'm not going to tell you. Well, then you're not supposed to be in here without a mask. It's probably best just to have a set standard for the restaurateur. If they're going to go and say masks are required before you get to your table, that's okay. I think we're all used to it. And truthfully, for the individuals who've been vaccinated, I don't think they're going to see a problem with it. Most vaccinated people are probably going to carry a mask with them anyway, knowing they may need to bring it and use it wherever they go. What I would suggest to all is if the restaurateurs, bar owners have a question, they should contact our Department of Health, Environmental Health Division. We can give them some recommendations on how to approach this. And if they have a customer who's very angry and refuses to wear a mask, I would just remind the customers that the owner of the establishment, the private establishment, can set their limits. They can say a mask is required to enter in here. It's like no shoes, no shirt, no service. Well, you know what? They can do no mask, no service. And you don't have a constitutional right to go into a private establishment and demand to be served without a mask on if they want to include it. So I just would hope that the message gets sent out that the CDC's recommendation was that people who have not been vaccinated or immunocompromised should wear a mask. It's no different than what it was beforehand, which is immunocompromised, unvaccinated, and vaccinated should wear a mask. They removed it for the vaccinated. But there's still a sizable portion of our population, approximately 50%, that have not been vaccinated. And they're still at risk. And we want those people to be safe. So if a restaurateur says no masks, no service, they have the power to do that. A bar has the power to do it, a grocery store, a movie theater. And if they do that, I would hope that the public would respect it. And I hope that the public would also go about and understand that if people are wearing masks, they may be doing it for various reasons. Health reasons that they have, a family member's health reason, as Dr. Burstein said, to set a good example for their children. So don't start yelling and mocking people because they're wearing masks. Well, that mask may be saving their life and you just don't know it. Okay, Channel 4, anybody on? Nobody on, Chris?
Hi, Mark. Yes, as far as the honor system, what can we expect moving forward with enforcement by the Erie County Health Department? A local grocery store chain yesterday announced that they're going to go by the honor system, that if somebody walks in without a mask, they will assume that person is vaccinated. But if it seems too good to be true and a place is filled with people with no masks, would the Erie County Health Department actually go to a place and proof for masks or proof for vaccinations?
At this point, we do have no intention to do that. We don't have an intention of being the enforcement police for private establishments. As I said earlier, we're going to require masks for all our guests and invitees, people who come in, our clients, to county facilities. We are not going to be the enforcement mechanism for others. It would be impossible for us to do that. We just can't enforce it for every grocery store, every movie theater, every bar, every restaurant. If we see outbreaks associated with establishments, we will certainly be in touch with those establishments, but we're not planning on being the enforcement mechanism. Channel 7, anyone on from Channel 7? If not, anybody else I did not identify? We'll do one more round, a speed round, so to speak. Sandra Tan, any more questions?
Yes, thanks. So there had been a takeover of a unit of the Alden Correctional Facility for several hours on Monday. I was wondering if you'd spoken with the sheriff's office or the sheriff directly and gotten any additional information about how that occurred and, what's going to be, that's obviously a source of very serious concern, what's going to be done to prevent this happening in the future. And just to follow up on my last question, is there any recommendation coming forth regarding schools and distancing between desks in light of the county's lower transmission rate?
Finishing up the second part, we had a conference call with school superintendents last week, informing them of what the CDC standards are, what the requirements are now that we're below 100. And it's very comprehensive. I'll have our folks reach out and can provide you with the guidance that we've given. But it was a very comprehensive call. We think school districts understand exactly where they're supposed to be. It's really in their hands. They can make the determination at this point if they go to the 3 feet separation, and many schools have. But it's really in their hands. And then on the first one, I called the superintendent of the jail in Alden, Tom Dina. I spoke to him earlier today. He informed me that there were 38 individuals that were involved out of, I think, 42 in this pod that were involved in what appears to have been a issue associated with a microwave and whether a microwave was provided. There appears to have been some ringleaders associated with this. Those individuals are going to be disciplined and potentially could be brought up on criminal charges, I've been told. It sounds like there was never a situation where the rest of the facility was at risk. It was not a complete takeover of the jail. It was one pod where there was an uprising where inmates refused to go back into their cells at the normal time at the end of the night. Rather than inflame it, it sounds like the sheriff's correctional officers left the scene, locked it, secured it because they were outnumbered. And then through discussions between the sheriff's office and the inmates, they were able to restore control. That's the information as it was turned over to me. As was told to me by Superintendent Dina, I have not talked to the sheriff about it, though I do appreciate the superintendent sharing information to me. And I'll just say that when I learned about it, it was very distressing, but I'm glad that there appears to have been no injuries, no issues other than the actual event, and hopefully we never see anything like this again. WBEN, any more questions?
Yeah, Mark, do you have any data on those who are currently hospitalized in Erie County and their vaccine status?
I don't have it off the top of my head. I think we can get that for you, but last I knew, it was like 98%, 99% had not been vaccinated at all. But we'll have to go. I don't know if the health department has that latest data. We generally get the data on deaths. We don't get it always on hospitalizations. But yeah, we'd have to go back and contact the hospitals. But last I knew, and that was about a month ago, the vast majority, I mean like over 90%, 95% plus of the individuals who were hospitalized had not even received a single dose of vaccine, though some people had.
Thank you.
WBFO, Mike Desmond, any more questions?
Yeah, Mark, last week you demonstrated considerable knowledge of the Erie County Fair and the food especially. How can, the fairgrounds are trying to work out the social distancing rule, but I find it hard to believe that you could actually enforce social distancing on a hot August day on the Erie County Fairgrounds.
Well, the fairgrounds is going to have to submit a plan to the State Department of Health because they have more than 5,000 attendees on any one day. As you know, the fairgrounds wants to get 100,000 attendees in a day. If you go to the fairgrounds, there are times during the day in which I think you could easily have 6-foot separation because there's not that many people there. But then on other days, it's crazy busy, especially at certain times of the day. So it's incumbent upon the Erie County Fair Society to submit its plan to the New York State Department of Health. The Erie County Department of Health will be in charge of permitting and enforcement. So we would certainly participate. It's just like the Taste of Buffalo. We reviewed and approved a plan for the Taste of Buffalo with social distancing guidance in place, and we would do the same for the fair. But if the fair is going to have to come up with a realistic plan, I believe, to get it through New York State. If they just say, hey, anyone can come, only a certain percentage will be sick, we'll have 100,000 per day, I'm not so certain New York State's going to approve that. But I think if they come up with a realistic plan to ensure that you don't have a huge amount of people at any one time, you've reduced social distancing to a point where everyone's crammed in certain areas, then I think we'll be okay. I mean, I don't know how many times I've been to the fair, especially as county executive. I go multiple days during the year. And you can generally walk and not have to worry about people touching you. You might have some issues in some of the buildings where it's tight squeeze sometimes, but in general, it's not too bad. So I think if they come up with a realistic plan, I would not be surprised that New York State approves it, but then we're going to have to implement it. And so we will want to work with our partners to ensure it's a realistic plan that can be implemented. Andy Young, any more questions, Andy? If not, Kelly, any more questions from WGRZ?
Sure. How do you close that gap with the zip codes that don't have the high rates of vaccination yet? Because some of them are half of what some of the suburban zip codes are.
Yeah, it's an ongoing concern and something we've been working on for quite some time, to the point where we're even talking about retaining and hiring outside parties to walk door to door. We actually have a proposal at the legislature to work with a Health Equity Task Force and their partners from Mount Olive Corporation to hire individuals to walk door to door to try to alleviate fears of individuals in the city of Buffalo as to why they may not be getting vaccinated. It's a conundrum. We are trying our best to find every way possible to vaccinate as many people. I mean, I myself at some of the shot and chaser clinics have walked around the tables and seen who's interested, and a lot of people are like, I'm fully vaccinated. They even show me their cards. I'm like, yay, good for you. Or Excelsior Pass, and then others are like, I'm never getting vaccinated. I wouldn't put that in my body because it's going to change my DNA. And I have to sit there and go, no, it doesn't alter your DNA. It has no effect to your DNA. Trying to alleviate concerns of individuals or myths that they have about the vaccine. It's not easy. And we know For some folks, you got to reach them with individuals that are trusted in their community. So I may not be the most trusted individual to someone out there, but maybe their pastor is. Maybe certainly their doctor would be. So we're trying to get those more trusted individuals for these hesitant but might be willing to take the vaccine residents to get it. And it's been tough. We've worked with a lot of partners. We have seen still first doses. So there are people who are getting first doses now. It's about 2,000 on a day. It wasn't that long ago, it was almost 10,000. So there's still more people getting their first dose now, which means maybe they wanted to see for those who had been vaccinated for a number of months if they had any issues. Well, they hadn't. So we're going to continue to work with our partners across the spectrum of the region to help vaccinate more people, because it's the only way that really in the long run we'll get back to a point where we're not holding these press conferences, we're not wearing masks when we're in meetings, and we're kind of back to normal. Final question, Channel 4. You still there?
Just to follow up to the last question, you pretty much made it clear you're not planning on being the enforcement mechanism in places that are on the honor system, but what would the Erie County Health Department still investigate at this point as it relates to COVID? Are there really any scenarios that you want to hear complaints from citizens?
I'll turn it over to the doctor. I mean, there's certainly going to be issues associated with employees who may be positive and being forced to come to work. There are definitely situations where our sanitarians would go out.
Thanks. So much of our active COVID-19 investigation really centers around case investigation. So if there's an outbreak in a workplace, we're going to be asking questions about the workplace. If there are some questionable responses about practices, and we may send a sanitarian to investigate. We've done that with schools in the past, where there was questionable about the seating arrangements and masking in the schools, and we've sent out, and testing arrangements, and so we've sent out sanitarians to inspect schools. So again, a lot of that really involves around case investigations. And then our public health sanitarians are routinely going out and inspecting food facilities, and so part of their inspection will not only include food safety, it also include adherence to COVID safety. So we'll catch a lot of places through our routine inspection. So that, and then of course, if we see for any type of situation, if we receive an overwhelming number of complaints about any one particular facility, we'll send sanitarians out to investigate that. So thanks, but we're really trying hard to get back to our normal routine as much as possible, because there's still a lot of restaurants that we need to check for food safety. There's a lot of homes that we need to check for lead. Life goes on. Thanks.
And as is the case with regards to the inspections by our sanitarians, you can always view any inspection report on our website. So if you have a question about your favorite restaurant, you can always go and take a look. You might not like what you see in the report, but you will find the reports because they are open and public information. With that, this brings to a close our Tuesday at 2 press conference today on COVID-19. As I talked about last week, we had not planned on doing this one today unless there were major developments. Well, we had some major developments, so we did have the press conference today. Do not expect to have one next Tuesday unless, of course, there's major developments. So if this is if there's no major developments, we'll definitely see you around. But we probably won't see us next Tuesday at 2 o'clock. You can always get the latest information on COVID-19 cases in Erie County from the Erie County Department of Health website, our ECDOH Twitter page, their Facebook page, posted daily. I thank everybody for doing the good job that they have this last month in reducing cases. It was not pretty, and it was pretty damn scary in March and April, and in a very short period of time. I think also because of so many people are vaccinated, we were able to reduce the case rates and get to a point where we are today. So on behalf of the people of Erie County, I want to thank you all for doing that. I thank Kendra Schmidt for her continued great work as an interpreter, as well as Karen Gambino, who's been here on other occasions. And I just thank everybody, and do the right thing to be safe and well. If you're fully vaccinated, depending on where you are, you may not need to wear this anymore. If a business, an establishment asks you to wear a mask, even if you're fully vaccinated, please wear a mask. If you're unvaccinated, please get vaccinated. There are still people dying in Erie County daily, and as we've seen, they're under the age of 52. So be safe, get vaccinated, and when we look back on this time many years from now, we'll realize we went through a once-in-a-century pandemic that unfortunately took over 1,800 of our fellow citizens, more than 500,000 of our fellow Americans, and we'll look back at the heroic nature of some individuals who fought this on the front lines, and we'll also look back at the steps that we had to take to become a more healthier community, a safer community, and I thank everybody for the tremendous work this past year and a half or so. It has been a long slog. The light at the end of the tunnel, we're nearing the end of that light. We're still not out of the tunnel, but we're close, and it's because of the great work of so many. So thank you for all your good work, and let's keep doing it to ensure that we protect as many people as possible. And until that day comes where we no longer have to wear masks by anyone in any setting, be safe and well out there, folks.